All right, welcome back to Pharmacist on Call. Your host, Dr. Sean Pruitt, owner of Pruitt's Discount Pharmacy, owner of the Kangen Water Store of Nashville. We're going to get right back into your calls. We've got Brian on 3. Brian, welcome to Pharmacist on Call. How may we help you? Hello, Brian.
Hello.
How you doing, sir? How may we help you?
Yes, I'm having a very severe allergy and sinus problem.
Okay. What kind of symptoms are you having?
For one, I have the sinus pressure. I have the sinus pressure all in my, all around your nose, your eyes.
Yes, sir.
And 90% of the time I can't breathe. What I found out is when I use a name brand spray, nasal spray, such as an Afrin or any of the major name brands, they're a little too strong for me.
Okay.
So I use the dollar store brand, and eventually, maybe 30 minutes, 45 minutes later, they begin to break loose.
Okay.
Also, I have been taking the allergy and sinus pills for the pain and pressure, decongestant.
Okay. Are you on blood pressure medication?
No, sir, I'm not.
Okay. All right.
They work they work for a little while. They really don't clear me up real good. They work for a little while. The biggest problem that I'm having is because I work outside, but during the day I'm kind of okay, but at night, like right about now when I get ready to lay down, I can't breathe, and the pressure's so severe till I'm about to panic. I've been going through this about 6 months now. I'm 55 years old. I really don't have any insurance to really go to an allergy and sinus doctor, and I'm just at my wit's end. I don't know what to do. I'm really about to panic.
Okay, yeah. So it sounds like you're at that point where you do need to see a specialist, an ENT.
Yes, sir.
Okay, so you might want to look at maybe a longer acting sinus medication. I think that the Aleve Cold and Sinus is supposedly a 12-hour medication.
Yes.
So you may want to look at getting it, and you can just go go to the pharmacist's counter, present a picture ID, and it should be able to help you. I think it's got a longer acting Sudafed in there.
Okay.
The only issue is, man, you got to be careful at night because it may ramp you up. So I'd probably take it early in the evening.
Oh, in the evening. Well, see, normally what I've been doing is I've been taking the medicine first thing in the mornings, like when I get up, because, I'm still suffering from the night. I can't breathe. I mean,
Okay.
Say, for instance, I go to sleep at 8 or about 10, I'm up for the rest of the night. I can't breathe. I'm walking.
Okay.
I'm pacing. It's about to drive me crazy. I'm at my wit's end. I really don't know what to do.
Let me ask you this. When's the last time you changed the air filters?
The air filter? It has been a while, I guess.
I would change those, and you may notice it improves quite a bit.
Oh, okay. Okay. So it could be something that's triggering it or keeping it going on in the house?
Absolutely, yeah. So if you notice that you're coughing only at night, or you're sneezing, or can't breathe at night, it's that the filters have gotten so inundated with just particulate matter that it's no longer circulating clean air through the house.
Okay.
So it needs to be replaced. So try that and see how it does. And that you'll notice, tonight or the next night.
Okay. And you said I should try what type of medicine?
Aleve Cold and Sinus.
Aleve Cold and Sinus.
Yeah, just take that in the morning.
Particular nasal spray I could use?
I think you're doing fine with the generic dollar store brand, so I would continue with that.
All right, sir. Thank you. Thank you. Before you go.
Yes, sir.
Is there any type of clinic or doctor you can recommend me to? Recommend me to, I'm sorry.
Depending on what area you in.
I'm in the South Nashville area, Wedgwood area.
Wedgwood area. Let's see, that clinic closed. You insured?
No, sir.
No insurance? Then try Clinica La Paz. It's on the corner of Harding Place and Nolansville Road.
Okay, Clinic a La Paz?
La Paz, L-A-P-A-Z. Just call me at the store tomorrow, and then I'll direct you to them. So they take care of a lot of uninsured individuals.
Thank you, Dr. Pruitt.
Yes, sir. Thank you.
Thank you.
All right. All right, bye-bye. Before it slips my mind, Pat, we want to get back to your question. So I was able to look up the diuretics. Chlorthalidone, do not take, has a sulfa group in it. So amiloride, as the other caller said, spironolactone, and triamterene. Those would be your 3 alternatives for diuretics. So, but Pat, if you need any further discussion about it, give me a call at the store. Producer will put the information up there. All right, let's see who else we got here. Marlon, welcome to Pharmacist on Call. How may we help you?
Yes, hi. I'm a big fan of your show.
Well, thank you.
Yeah, you have a lot of information that we always can, relate to out here in the public that's unserved in this part of Tennessee. I think my question mainly is about baby aspirin.
Okay.
With baby aspirin, is it okay if I take it too? Because I have a ton of it.
Yes, it's fine. In fact, it's just the dosage form. It's in a chewable tablet, but it's 81 milligrams, and many of your doctors are going to recommend you take that, especially if you've had a heart attack before or you're hypertensive and at risk for a heart attack. They say that it prevents you from getting a heart attack. So yeah, 81 milligrams, whether in chewable form or a tablet, is just fine. I have many adult patients who do take the baby aspirin.
Okay, because my cousin Bertha, she works at an OBGYN, and she got me, I don't know how, like a stockpile full of baby aspirin. I don't know what to do with them. Maybe I should sell them online or something. I don't know. But my other question is relating to Jack Daniel's barbecue sauce.
Okay.
Can I mix my aspirin in there? Because that stuff tastes good.
Well, I'm not sure that you should have Jack Daniel's barbecue sauce on a daily basis.
Okay.
Yeah. But you don't like the way that the baby aspirin tastes by itself?
No, not at all. No, I tried it on salads, I crushed it on everything, but it don't taste good at all. Now, the other thing I want to find out is this aspirin, I think it has a side effect because every channel I turn to, I just see like a Barney colored clothes on people, and I don't know if that's right or that's me or what's going on.
Oh, like it's giving you kind of hallucinations?
Yes, like it makes me, like see things on TV. Like right now, I think I see Barney on the TV, and I don't know if that's right or
Well,
wrong.
my attire is purple, so yeah, you should be seeing the color purple today.
Okay.
Yeah. So you're normal.
Thank you so much, young man.
All right, thank you. All righty, bye. So as I always say, I do provide the information, but you all make the show. All right, let's go with Beverly. Welcome to Pharmacist on Call. How may I help you?
Hello, Dr. Pruitt.
Hello.
Well, your previous callers have touched on two questions that I had. So the furosemide and sulfa drugs, because I've been taking that, and I get a rash every now and then.
Mm-hmm. Yes, ma'am. So chances are you're having a reaction. Well, every now and then, if you were allergic to it, it's going to manifest.
Is it?
Yeah.
Well, sometimes it does. It manifests, and then I can't get rid of it for a while. And then, I use they had prescribed an antifungal cream.
Yes, ma'am.
It doesn't really seem to help.
And that's why, because it's an allergic reaction.
Okay.
Mm-hmm.
And the other thing that I had a question about the alkaline water, but you answered that also. I have a friend that takes omeprazole for acid reflux.
Mm-hmm.
And so I was wondering, what he could do other than that, because the omeprazole does not seem to work.
Oh, yeah. The water will neutralize that. I haven't seen a case of acid reflux that Kangen water has not been able to whoop.
It will not work?
It works better than the omeprazole.
It does?
Yes,
okay.
ma'am. And then the other piece that I always tell people, just so that they're not causing acid reflux unnecessarily, do not eat heavy and then lay down within 2 hours.
And then lay down within 2 hours.
So make sure you sit up and give your food time to digest. Also, don't eat the triggering foods like the hot, spicy foods, especially knowing you may have a bleeding ulcer.
Okay, no hot, spicy food.
Correct.
What about drinking beer or that kind of thing?
Beer, yeah, alcohol will probably flare it up as well. Certainly beer, yeah, because it make you a little gassy.
It will
Yes,
flare it up, okay.
Mm-hmm. Yeah, but like I said, the alkaline water will neutralize that.
Okay, well, we'll be checking you out then.
Yes, ma'am.
Thank you, Dr. Pruitt.
Yes, ma'am. All right, thank you. All right, Don, welcome to Pharmacist on Call. How may we help you? No, Don.
Yeah, Dr. Pruitt.
How you doing?
I'm 66 years old, and I'm taking 5 different kinds of blood pressure medicine, and I still got high blood pressure. One of them is HCTZ 25 milligram. Another one is chlorothiazide 250 milligram.
Okay.
Another one is lisinopril 4 milligrams.
Okay.
Another one is
Lodipine.
10 milligram, and tamsulosin 4 milligram. And my blood pressure's still high. What's the deal?
What is your blood pressure running?
Well, it's anywhere from 90 to, on the low side, to 145, 50, something like that.
Okay. Well, some of the doses seem kind of low, so we could probably, or we may just need to go with a different medication altogether.
You think I just need to change doctors?
Well, no, I wouldn't say that. It probably hurt his feelings, but maybe you need to get on a beta blocker to slow down that heart rate to help bring down your blood pressure. But what I would just add on the natural side to help, what I offer many people to help with their medication, is this guy right here, beetroot juice.
That's what I've already done. I've started using beetroot juice.
Okay, how much of this are you taking a day?
Just a capful.
Okay, and if it's still not bringing you down, then add on a second dose.
2 capfuls?
2 capfuls,
Okay.
Yeah, see what that does for you.
And do you think I might ought to change doctors?
Well, with just the limited information, I'm not sure what you all's relationship is like. I wouldn't necessarily do that. I would first speak with him about why your therapy is not working and see if he's willing to listen to you.
Yeah.
So that you can.
Well, I'm not seeing a real doctor. It's a
Nurse practitioner?
A nurse practitioner is what I have to see. I ain't seeing a real doctor.
Okay. Well,
I can see a real doctor. You think that would be better?
I think nurse practitioners are able to provide the same type of care that a prescriber, a physician is. It's just getting them to listen to you, let them know what's going on, and that, hey, I want to get my blood pressure in check, and what you have me on is not doing it, so can we try something different?
Well, sometimes my heart beats so hard that it feels like it's going to jump out of my chest.
Yeah, and that's why we need something to deal with your heart rate. So if we could maybe get you on a beta blocker and slow that heart rate down. It's supposed to be the job of
amlodipine. A beta blocker?
Yes, sir. So you could just mention that word, and they may kind of know, hey, maybe this guy knows what he's talking about a little bit here.
Okay. All right, I thank you.
Yes, sir. Thank you. Lynn, welcome to Pharmacist on Call. How may we help you? Hello, Lynn? Hello, Lynn? Okay. Hello, Lynn. Welcome to Pharmacist on Call. How may we help you?
Hello?
Welcome to Pharmacist on Call. How may we help you?
Hear me?
Yes, ma'am. We hear you.
Oh, yes. I have stage 4 kidney disease,
Okay.
and I'm on different medications. But do you think there's anything I can take that will help my condition?
Yes, ma'am. Are you on fluid restriction?
Not yet.
Not yet? Okay. So a couple of things. The first is the Kangen water that, I've talked about a couple of times during the show. Before I became a heavy drinker of the Kangen water, before I even opened my pharmacy, a gentleman was telling me his testimony about it. He said he was at like stage 4 renal failure, and he drank only the water for like 3 months, and he had marked improvement on his kidney function, but just drinking the water alone. So I would recommend it. And if they do put you on fluid restriction, make sure it's just the alkaline water that you're drinking. The second thing is.
So this collagen water is just alkaline water?
Yeah. It's the top of the line alkaline water, Kangen water,
okay.
pH 9.5. Okay. The other thing is beetroot juice. What I just mentioned with the other gentleman, for hypertension, is that it also helps to heal the internal organs like the kidneys, the liver, the pancreas. So I would look at beetroot juice as well with the alkaline water.
Beetroot juice?
Yes, ma'am. It's juice from the root of the beet.
All right. And you think those will reverse my condition or help?
Well, depending on how disciplined you are with the therapy, yes, ma'am.
So just that water? You saying not to eat or drink anything else, but just drink that for a month?
Just that water, yes, ma'am.
So So like go on a fast for a month and not eat anything at all or drink anything but water.
No. If you're going to drink anything, make sure it's just Kangen water, because if you're just drinking sodas, that's taxing your kidneys because it's acidic.
Yeah.
Fruit juices are acidic.
I don't drink soda or anything. I eat mostly organic foods. I don't drink any soda at all. I drink barely drink juice. I drink a lot of water. But I eat a lot of fruits and vegetables, so
Okay.
I don't eat any meat either except fish and eggs.
Okay, so good. So it sounds like a relatively moderate to low protein diet. But yeah, make sure you're drinking the right kind of water. So you need a high pH water that will assist the body in maintaining its acid-base balance. You won't tax the kidneys as much with the Kangen water.
Okay. All right.
So stop by and see us.
Where are you located?
We're on Dickerson Road. We are about about a mile from Titan Stadium, just straight down North First there. 811C Dickerson Pike. Yes, ma'am.
811 Dickerson Pike?
Yes, ma'am.
Okay, and you see patients or?
Well, we're a pharmacy, but we're also an alkaline water store. We will be seeing patients probably within the next couple of months. But we'll talk about that in the next show.
Okay. All right.
All right.
I'm sorry, I cut you off, but what, do you have other supplements at your store?
Ma'am?
Do you have other supplements at your store?
Yes, ma'am. We carry a full line of supplements. Yes, ma'am. So we're a pharmacy and an herb store.
Oh, nice.
Yes, ma'am.
So you offer like herbal consultations and stuff?
We do. Yes, ma'am. Or I do.
Wonderful.
Yes, ma'am.
Do you have any other modalities that you offer? Modalities?
Modalities that I offer?
Excuse me?
What was your question, ma'am?
Do you have any other modalities that you offer there?
No, that's pretty much it. The Kangen water, the pharmacy. We'll be opening up a wellness clinic pretty soon. And then, of course, the herb store.
Okay, wonderful.
Yeah, so stop in. I think you'll enjoy it.
Out.
All right, stop in and see us.
All right, thank you very much.
Yes, ma'am. Thank you. All right, if you stay right there, we're open another break.